Thanks, JT. Well, talking about injuries here, a couple times this year we've had the good fortune to be visited by the good doctor, Dr. McGinley, the McGinley Clinic, with very motocross-specific solutions to injuries. But I got bad news. We're going to bring it up here for JS7. We're going to talk ACL tears. I've been there, but yours probably cost you a little more than mine. I can still limp into the TV trailer, but that was a bummer a couple times in your career. Oh, we got to show the footage. Washougal 07, bud.
Yeah, right here. I was in third place. I went down in the first corner, and as you can see, I hit a rock right there and just planted my foot. And that was the first time I tore my ACL as a professional, and I knew instantly, just kind of like Eli Tomac, there was no thoughts of anything about motorcycles at that point, Doc.
It's done. Okay, so Dr. McGinley, ACL tears pretty common, unfortunately, in a lot of sports. What are some of the solutions you've come up with?
Yeah, ACL tear is the most common knee injury. Cringeworthy, that video, that's for sure. You know, as far as treatment for that, surgery is the way to go. If it's a complete tear, we have an animation coming up that basically shows exactly what you did in that video. You get a twisting injury, it grabs that ACL, tears it, and then you have that instant pop, that instant pain and swelling, and then instability within that knee. So if you have a complete tear like this, surgery is the most viable option. But if it's partial tears, we have treatments for that: cell therapy, bracing, and then strength training, getting back out there.
So are there some things, go ahead, to help speed that process up? Yeah.
Yeah, that's what I was going to ask. And the other question, if you have, what do you think with surgery? Like, if it's partially torn, like, is it better just to get the surgery done because it's more likely to get a tear, or what?
It depends. For a partial tear, an MRI is critical just to get that information and see how bad that tear is. If it's a partial tear that can be salvaged, then, you know, the best surgery is no surgery. So if you can save that, cell therapy along with specific bracing. You know, we talked about bracing in the past, but with knee injuries, bracing has really progressed. And then that, along with cell therapy such as stem cells or PRP, can use your body's own healing power within the cells. They can help heal that tissue, help solidify that ACL. And then if you pair that with a brace that is specific to that injury, you can get back out there without the need for a surgery. So it just depends.
Yeah, no, that's good to know, because again, I kind of have both of them. So this is the process of the stem therapy with the blood and whatnots. And what do you think? I mean, I know it's kind of hard, but is it one of those things that it's just kind of time, like you start doing that stem therapy for a partial torn, you do the stem therapy, and then you can actually see it like growing or growing back together, or how does that process work on that?
So it doesn't grow the fibers back together. It helps to strengthen and solidify the fibers that are there. And if it's a partial tear, it'll solidify that structure.
Gotcha.
And then you can strengthen the muscles around the knee, so the quads, the hamstrings, the calf muscles, and all of that will provide additional stability. Again, you know, we can never make things as perfect as they were when we started. So yeah, if you can avoid the surgery, that's definitely the preferred method.
No, and that's the doctor saying that. Yeah, you would prefer to visit your clients and do other things besides just surgery. Now, we've had so much success, brought you on the show a couple times, shoulders, knees, things that normally wrists happen in motocross injuries. We're going to have you for a symposium that riders can visit at Ironman National. Yeah, we'll be back at Ironman, and looking forward to that. The Combine will be out there. We're going to be hosting a symposium. We've been getting a lot of requests for information, especially about arm pump. So we'll do an on-site symposium, and then shortly after we'll have a web version, an online version, just in case people can't physically be there. So all that information will be coming out. It'll be on the social media sites. It'll be sent out by email to any of the riders that are registered for the races. Okay, yep, and there's a big amateur contingent. Like you said, we have our Moto Scouting Combine at Ironman. That'll be in 2 weeks. All right, Doc McGinley, appreciate it. Try not to think about the ACL stuff too much, man. It brings back bad memories for probably all of us.